need a producer. I'm not used to all this stuff yet. Test. I wonder if we're able to be heard. Try now. I'm asking somebody else who's in the YouTube if they can hear me. Because I don't want to share the YouTube if it's not gonna.
So we're on this thing and then you're gonna broadcast it through YouTube.
It's broadcasting now. But no, I don't see anybody in it yet because I haven't tweeted it. Oh, there we go. Trent's in. How did he get the link? All right, I'll share. All right. Hey, Trent, what's up? Hopefully this will work. Trent, post another comment if you can hear me. And I can't find my sound. Test. Can hear us? Okay, good. Thank you. We can hear you. Okay, thank you. I'm sorry. Today's been kind of wild. Loud and clear. Okay, good. The reverb and the echoing in this room is not great because we don't have a rug in it yet. We just have the floors installed. So the paint's not done. You guys don't care. Just saying. What's up, Steve? Can you hear me? Oh, wait, I have to add him. What's up, Steve? How are you?
I'm
Can you hear
doing
me?
well.
Good.
What's up, Steve?
Hey, Josh.
All right, so here we are at the just before the live or the presser, Pritzker presser. He's expected to announce today that the indoor mask mandate is coming to an end. What's the rumor? February 28th? Did his office say that today? I think a little trial balloon went out this morning. So I'm most curious to hear him speak to or answer questions about the struck down school mask mandate. I know people are saying, when is he going to lift it? And I say, it's been lifted. Thank you, Judge Grishow. So we'll see how he addresses that. I want to hear the press, somebody from the press, a reporter, ask him if he's going to withdraw his appeal. I think he should. I think it would be wise. We've got rise of the resistance in Chicago area high schools, especially, that have chosen to not go mask optional. Steve, you're downstate. What's going on down there while we're waiting? Let's chit chat. What's going on down there? Give us the report.
I'll tell you what, downstate is wide open for the most part.
Nice. Now, what about schools?
Schools have listened to their community after this judge's ruling, and we are no longer, I didn't ever think we were bound by his rulings, but a lot of people did, and attorneys advised schools. But now, we're seeing most school attorneys advise to do what your community.
Here we go.
does.
Here he is.
Dr. Ngozi Ezike and Dr. Emily Landon, the Executive Director of Infection Prevention and Control at the
Ezike's here.
University of Chicago Medicine.
Whoop, whoop.
We're all here to provide you with an important update on Illinois' progress in protecting our hospital bed availability, supporting our healthcare workers, and keeping schools and businesses open. In many ways, the last 5 months have been some of the most frustrating days of the pandemic for healthcare professionals, for working parents, for vaccinated residents, and for all Illinoisans who never asked for and never deserved the challenges of the present moment. But throughout every minute of this deadly global pandemic, the people of Illinois have demonstrated a willingness to look out for one another and to rise above the loud minority of voices who have used this
Oh my
emergency
goodness.
to
That's us.
naysay, bicker,
That's
polarize,
us.
and divide.
Mm,
Last August,
trying to
Some
talk
in
of
the
about
that
this.
face of
Minority,
a
though.
growing threat from the Delta variant, most Illinoisans put their masks back on in response. And as a result, we ended 2021 with fewer COVID-19 hospitalizations per capita than anywhere else in the Midwest. More Illinoisans have gotten a COVID-19
Fact check.
shot than
Yeah,
anywhere
let's
else
talk
in the
about
Midwest.
from and
More of
with
our kids are fully
hospitalizations. That data
vaccinated
needs to be
than
revised and
anywhere in the region.
reclassified to
Nearly
reflect
80% of our
people
eligible
hospitalized
seniors
because of
are
COVID.
boosted. Vaccines work. Masks work.
Oh my Lord.
Throughout
Well, he
this
makes stuff up
pandemic,
all the
we've
time.
deployed the
Yeah, I know.
tools
Yeah,
available
work for
to
what?
us as needed.
Work for him.
We've used
Work for control.
masks more when infections are raging and hospitals are stretched thin. We've used masks less when spread is diminished and hospitals have enough bandwidth. Our approach has saved lives and kept our economy open and growing. Today, 3 weeks past the peak, and thanks to the precautions our residents have taken from Chicago to Carbondale, the heightened emergency of Omicron has been.
I'm not really sure on that graph where
subsiding.
masks were working.
We are now seeing the fastest
Right?
rate of decline
Where do we
in our
see masks
COVID-19
working?
hospitalization metrics.
I mean, did
since the
anybody else
pandemic
call this? He
began.
was going to take credit for this?
Our daily
course.
total of COVID patients in the hospital has fallen from over 7,300 to about 2,500.
Remember, COVID
today,
patient,
a
IDPH
66% drop. The
combines
daily total
confirmed
of
positive
COVID
and
patients
PUIs in
requiring
their data.
ICU care has also seen a 63%
God, I wish you'd just get through all the fluff and just say what you're going to do.
We now have 20%
Right.
of our ICU beds available statewide, up from a low of just under 8% only 4 weeks ago.
And I wish he would have,
Vaccines
sort of
work.
put South Dakota on there
Masks
with him to
work.
compare.
Right.
And as a result of them and the tremendous commitment of our state's residents, we are on track to come out on the other side of this latest COVID storm in better
God.
shape than even the doctors expected.
COVID response
If these
storm.
trends continue, and we expect them to, then on Monday, February 28th, we will lift the indoor mask requirement for
If.
the state of Illinois. I want to be clear. Many local jurisdictions, many businesses and organizations have their own mask requirements and other mitigations that must be respected. Doing what's right in your private business or for your local communities is encouraged. Whether you're a business, a township, a venue, a place of worship, or a city, to name just a few examples,
A school?
protecting your patrons and visitors is no doubt
Those
a
are
high
indoor,
priority.
right? They're indoor?
Masks continue to be a very effective way to keep your establishment from experiencing an outbreak or spreading the disease. The lifting of those who choose to wear masks. Remember that whether we remove masks or not, COVID-19 has not gone away. There are so many Illinoisans who need to protect themselves from the virus more than others. And many more of us who gladly put on our masks, not so much for ourselves, but for our elderly neighbor, for our immunocompromised aunt, for the toddlers for whom there is not yet a vaccine, for adults who are medically unable to be vaccinated, for the person in the room whose circumstance they do not know. Compassion and kindness toward each other is the hallmark of being an Illinoisan.
I try
All
not
the
to
feelings.
lie to
We are.
people that I
And
care
whether you're
about.
wearing a mask or
All
not,
the feelings.
everyone
All the
deserves
feels.
to
All the
protect
feels,
themselves.
Pritzker.
Everyone deserves to protect themselves and their communities in whatever
Everyone
way
deserves
they
to
feel
protect
you've already
themselves
been
and their
vaccinated,
communities.
or get your
It's
first
not
or
it's not
second
my
shot
job
if you haven't yet.
to
Right now, 2.9
order my life around other
million
people's
Illinoisans
health,
are
nor other
eligible to
people
get a
around
booster
me.
shot, but haven't gotten around to it. If
Isn't
that's
that
someone you
contradictory
know,
to what all he's
reach
done?
out
Everyone
and encourage
deserves
them
to
to take
protect
that next
themselves.
step.
That means
And of
everyone
course,
has
it's never
personal
too late to
autonomy
start the
to
vaccination
protect
crusade
themselves.
with someone
Right.
you love.
I mean,
Yesterday, approximately
he's talking in tongues.
70,000 Illinoisans got the COVID-19 vaccine for the very first time. Find a vaccine location near you at vaccines.gov. I also want to take a moment to address our schools. In-person learning in a healthy environment is what's best for our children. School outbreaks impact hundreds.
Oh, shoot.
School
There we go.
outbreaks impact hundreds, even thousands of people across a community. And there are a whole lot more infections when districts are maskless. Schools are
What?
unlike most other
No.
environments. There are
No.
far lower
No.
vaccination rates for
Fact
school-aged
check.
children
No.
and
Yep.
adults.
No data
Higher
there.
exposure to on a daily basis to younger children who aren't yet vaccine eligible, and more difficulty maintaining distance in hallways and gyms
Oh my
and classrooms.
gosh. Now he's shaming children.
The equation for
course.
schools just looks
Divide,
different
divide,
right now
divide.
than it does for
Yep.
the general population. Schools need a little more time for community infection rates to drop, for our youngest learners to become vaccine eligible, and for more parents to get their kids vaccinated.
No.
The protocols
They're not going
and
to.
tools that we've been
No
using thus
coercion.
far have worked to keep
What
schools
statute
open,
do you state that
and
we
they've
can
done
do
it
this with
because we have
schools? That's what
masks,
I like to know.
testing, and vaccines. Remember that our goal is to maintain a healthy in-person learning environment for kids, teachers, and staff, and to protect all parents and grandparents who interact with our schools, and to avoid adaptive pauses and remote learning. Schools are open and should remain open. Protecting everyone in a school community, their education and their health, is our highest priority. In the coming weeks, it's my hope and expectation that we will continue making progress to a place where we can remove school masking requirements and keep kids.
Who's we?
in
There are
schools.
no school.
So I wanna
He has
thank you,
no
and
school
now I'd like to
masking
turn it over
requirements in
to our,
place.
Stellar
I don't know why he's
state's
talking
top
like
doctor, and
he
that's
does.
Dr.
Although I
John
guess
Pritzker.
he was sort of talking passively, like schools mask requirements, right? Like sort of not saying that. But although I said we,
Good
no.
afternoon.
Up
and
here's Ezekiel.
happy
We haven't seen him in a
Wednesday.
long time.
As we all know, we are now into year 3 with COVID, and it has been a roller coaster ride that no one asked
Yes.
to get on. But through all
That's
of
true.
your efforts,
Truth.
we have reached a point where we can take another step towards getting back to life before the pandemic.
I'm glad she admits that all
While
of our
masks will no
help,
longer
like
be
my efforts.
required in most
Right.
indoor locations beginning Monday, February 28th,
of not
I
wearing
want
a
to be
mask.
clear that they are still highly recommended.
Even though they
There are
don't
places
work.
where, in fact, the mask is still required. The federal government still requires it in transportation, airplanes, trains, buses, subways. And masks are still required inside federal buildings in areas of substantial or high community transmission.
Because federal buildings are more
Additionally,
dangerous.
the Centers for Medicare and Medicaid Services continues to require visitors to long-term care facilities, such as nursing homes, to wear a mask when in the communal area of the facility.
Jeez.
Masks offer a layer of protection, and for people who have an underlying condition or who are around people who do have that condition, or for those who are around children who are too young to be vaccinated, you absolutely may choose to continue wearing a mask.
I hear.
Similarly, if you find yourself in a crowded indoor setting,
I'm hearing from somebody who's in the
mask will
press room right
continue
now
to
that
help
Dr.
protect you.
Emily
We
Landon
will
is there.
continue to
So we
recommend
may get
masks.
to
As we move forward in a world
see a
where we
performance from
will
her today,
coexist with COVID,
the COVID
there
drama
are
queen.
tools, there are masks that will help protect us and help prevent our healthcare system from being overwhelmed. Of course, we have an even stronger tool than the mask, and that's our vaccinations, including the boosters. And that is our very best tool for preventing severe illness, and we will continue to encourage people to stay up to date on their vaccines. We are still seeing, of all the people in the hospital with COVID, that 89% are unvaccinated.
It's such a lie.
Another tool that we have include the therapeutics.
I don't know about
We
that.
have oral
What did she say?
antivirals. We have
89%
the monoclonal
are
antibodies.
Of
Down
who?
here, it's
These
more like
medicines, which have
In the
come from the
hospital?
federal government, are
Well,
absolutely in limited supplies, but people who test positive and are at severe risk of illness should talk with their healthcare provider as soon as possible about using these possible
Remind me after the
treatments.
broadcast to get back
Our
to that stat that
future,
she just
our
cited.
new normal, if you will, is going to look different. And yes, we may see additional surges. There may still be additional variants. Example that we need to continue talking about is improving indoor air quality. Schools, workplaces,
This is nauseating, guys.
businesses,
I know. She's
any,
always been
any indoor
so
location
panicked.
should look at what upgrades
Can you imagine if
be
the
made
virus
to their
killed
ventilation
like even
systems to
like
reduce
even
the infectious
2% of
particles in
people?
the
I mean,
air.
she would be off
This
the
might even apply
rails.
to your home where you can
so
purchase
this
maybe
is
a
just
portable
an
air
example
cleaner
of how
with a HEPA
completely out of
filter.
touch they are with
Your
Illinois.
actions
Yeah.
that
And
you've already
I
taken
mean,
have helped to reduce the
around me,
amount of
we
virus
have
circulating,
never
and
complied
it
to any of the
absolutely has
mitigation
saved
measures,
lives.
and our
But be clear that
rates are
COVID
fine,
is not
always have been fine.
gone,
She
and
has
it won't
no
be gone on
idea
February
what normal
28th.
people in Illinois
So
live
we're
like.
going to
Mhm.
continue to find ways to live with the
Out of
virus.
touch.
Our path forward includes keeping these tools that we've been talking about close, and that's the masks and the vaccines.
Keep them close, John.
testing, creating
And your
safer
enemies closer.
vaccines,
Keep your mask
testing,
close and your enemies
creating
closer. Is
safer
that what? Is this a
settings
God?
through
Is this?
better
Are we watching something
ventilation.
from The Godfather right
We
now?
can do all these things, and we can coexist.
I'll get to the
with
89% of hospitalizations claim
Now
after
I'll,
the presser
repeat
is
the
over. We can
remarks in
chat a
Spanish.
bit.
Buenas tardes y feliz
Oh,
miércoles.
and well,
Los últimos 2 años han sido un paseo en la montaña rusa, pero gracias a todos sus esfuerzos hemos llegado a un punto en el que podemos dar un paso del lunes el 28 de febrero.
I don't know. You know, I don't know how he can. They can claim that. Okay, we're going to remove this indoor mask mandate, which is unlawful as well, by the way. But pretend that schools are riskier. We know from every study that transmission in schools is low, even when community transmission is high. So I don't know how they can be in denial about that. School is safe. Christian Liberty Academy in Arlington Heights, shout out to them. They have been open and mask optional since August 2020. Let's see their data. Let's see their data, right?
Right.
They're just making things up.
This is what drives people crazy, guys, because we have access to data, we have access to information, and people are like, why are they not telling the truth? What are they getting out of this?
I don't know. Power, money.
Es posible que quieren seguir
You know,
usando una
even
máscara.
Vandalia tracked
Del
their
mismo modo,
data,
si se
the school that was
encuentra
fighting
en un
SBE,
lugar
and Vandalia's
interior
data
lleno de gente,
proved
una
that
máscara
they
puede
were not,
ayudarlo a protegerse.
causing a health hazard. They were
Sure.
actually causing
Seguiremos recomendando el
more of a health
uso
hazard
de
by masking
máscaras.
children.
Sure.
A medida que
And a
have
mental
data.
health
avanzamos en un
hazard.
mundo
And a mental
Yeah,
health
and
en el
hazard.
que
Yeah.
We absolutely have
coexistiremos
data.
con el COVID, existen herramientas como las máscaras que nos
Yeah,
ayudarán
the kids are
a
pushing back. I
protegernos
can't tell
y a
you how
evitar que
long I've
nuestro
waited for
sistema
that,
de
right? But it's been
atención
hard.
médica
It's been hard
se
for
vea
kids because
abrumado.
they want to be in
vacunación,
school.
incluidos
And I think a
los
lot of kids are
refuerzos,
associating,
sigue
the
siendo
mask
nuestra
requirement
mejor
with being in
para
school.
prevenir
I
enfermedades
mean, I know high
graves y
schoolers, my own high
continuaremos
schooler, I
animando
mean,
a las personas a
he
mantener
does not want to
al
be
día con
shut
sus
out of school.
vacunas.
He does not want to be at
Todavía
home. My daughter
estamos
doesn't want to be
viendo
at home. So I
alrededor
think some
del
kids psychologically have
89%
consented to this
de
because
todas las hospitalizaciones
remote
por
learning was so
COVID-19
traumatic
entre
for
personas
them.
que no
Let's be
están
honest.
vacunadas. Otras herramientas
It was
que
now
tenemos
that we
para
see schools
avanzar
opening up and
incluyen las
kids
terapias
sort of empowering themselves.
antivirales orales
We
y
have to ask
anticuerpos
ourselves,
monoclonales.
what have we taught these
Estos
kids? I mean,
medicamentos del gobierno
we are
federal
now
tienen un
we now are looking at
suministro muy
at
limitado
least in
en
high
este
school, I
momento,
think,
pero las
some
personas que dan
of bitter
positivo
kids. They're
corren el
bitter
Yes,
riesgo de
towards the authority
sufrir
that
una
did this.
enfermedad muy grave. Deben hablar con su proveedor de atención médica sobre estos posibles tratamientos. Nuestro futuro, nuestra nueva normalidad, se verá diferente y puede que veamos nuevas oleadas y variantes.
Yeah, I think John,
Pero hay
John Halgren,
cosas
you're
que
right.
podemos
You
hacer
know, like
para
kids,
ayudar a
kids right
reducirlas.
now,
Un
why should
ejemplo
they
es
trust what the
mejorar
adults
nuestras
are
calidad del
saying
aire
or not
interior.
saying? I think
Las
Judge
escuelas,
Grishow,
los lugares
you know,
de
gave them the
trabajo,
signal and
las
the
empresas
permission
o
that they
otros
needed.
lugares
And not
interiores
only that,
deben
you know, when do
considerar
kids
la
rise up and when do
actualización
people rise up?
o
When there's a perceived
mejoramiento de sus
injustice.
sistemas
So the
de
perceived
ventilación,
injustice, I
incluso
think,
a
for a
su
lot of kids right
propio
now
caso,
is
usando
like, hey,
incluso a su
you know, somebody who
propio
goes to
caso,
Naperville
usando
North,
una
they have
purificador
to
de
mask,
aire
but somebody who goes to
con un
Wheaton
filtro
Warrenville South,
HEPA.
which is what, not even
Sus
10 miles
acciones
away, 5
han
miles
ayudado a
away,
reducir la cantidad de virus
doesn't
que
have to
circula.
mask.
Lo
I
que
mean, that's an
realmente ha
injustice, right? From
salvado
a teen
vidas.
perspective and from my
Pero el
perspective
COVID
too.
no
It's a bodily
se
autonomy
ha ido,
issue.
por
So
lo que
maybe now
debemos
kids are
encontrar
seeing
maneras
that
de
injustice with the
sobrevivir con
differences
el
in how
virus.
districts are responding to the judge's
Nuestro
ruling.
camino por seguir incluye mantener nuestras herramientas a la mano,
Right? I mean,
máscaras,
we've seen that
vacunas,
here where I live,
pruebas
right?
y
Iowa,
crear
and
lugares
like
más
we're a
seguros a
rural
través de un
so
mejor
all year long, kids
ventilación
have seen
y
and they've went across the
distanciamiento.
river to play
Muchas
sports and
gracias para
things.
su
Right.
apoyo.
Wait a
And with
minute.
that, I will turn
Why
it
are
over
we
to
this
Dr.
way when
Emily
across
Landon.
the river they're not that way?
Oh my gosh, she put her mask back on. This is such performative theater. So are they not going to mask indoor when it stops? Do you know, or when the
No,
mandate is lifted? Are they going to take
their
off these?
choice.
Oh my gosh. Okay, here we go. Emily Landon.
Day is not the day to stop the mask mandate. And that's
Oh
why it's not happening today. There are still
As she
way
takes her
too many
mask off.
cases, but things are
Pretty
changing
dramatic.
quickly. They're improving. Many
Wow.
have asked for a metric or a number that will guide the rules and regulations, but each wave of this pandemic has had different
I'm sorry,
characteristics, different
but
behavior,
they are
and
making
no
themselves
single metric has
laughing
been able to
stock
reliably
of this
predict the
state and
outcomes
this
and the
country with this
trajectory of
presser.
each of the
The
variants.
absolute laughing stock
Smart
to normal.
physicians, science. Smart physicians, scientists, epidemiologists, and public health officials are going to disagree.
I'm
about
bothered
which
that
method
people are
to
watching
use
this
the
and they're
exact
believing every
to
word of it.
repeal mandates and rules.
I
This
mean,
is
they
such
can't.
theater.
Discourse is good. It shows that we have a diverse community of experts that are considering all the angles. And the one thing that we all agree on is the need to aggressively respond
No.
to new threats on the horizon.
No, we don't agree.
Cautionary-
We don't agree that COVID's a threat, first of all.
What about natural immunity? I haven't heard one word about it. I've been talking about it for a year and a half. As being a cattle producer, we know all about it. I mean, people like me have seen this kind of stuff out.
masking mandates at the
out.
end of the month is
Why don't they
aggressive and
talk about it?
optimistic.
They now admit it.
but it's also
CDC admits
reasonable.
it.
This does not mean that no one needs to wear a mask anymore. It's an acknowledgement that cases have fallen to an acceptable or manageable level.
What's acceptable?
Hospitals can
According
handle
to
the sick.
who?
Businesses are likely to be able
Hospitals
to stay
have
open.
never been
The cushion of
overwhelmed in
immunity
this
from
state.
just
Never.
so many
During this
Omicron
whole
cases
thing. In fact,
will help
they've
shield
been
us from the
down.
exponential threat
Been
that is so
relatively,
threatening in the short term.
much lower than
Helps to have
2017,
everyone
2018 in
masked.
Chicago.
But
That's
when
for
cases
sure.
helps to have everyone masked. But when cases are low, the likelihood of encountering someone with COVID is
So they know they
also
can't
low,
enforce it,
making
but
universal
are they going
masking
to get
mandates
people
less
convinced to try to
impactful.
still do it? That's my question. Will
Broad
people
mandates
still
are
do it
not
after
about
fear
individuals.
presser?
They're put into place to help protect communities,
Is
businesses,
Pritzker coming back
healthcare
on or no?
access. But no matter when the mandates are
He will
repealed,
answer
we
questions.
have to keep our eyes open for those new threats. The subvariant of Omicron BA2
This is
has been
drivel
introduced
with you,
to
Josh. It's nauseating.
online. A
I
lot of people
can't handle
about this,
it.
including me.
I mean, it
It's
is.
more
It's
Omicron, but not materially different in terms of vaccine effectiveness.
The
or
Chicago
severity of
Thinker,
illness.
which is a
It
student
has the potential
newspaper
to
at
maybe
University of
slow down
Chicago
the
and probably the
trajectory
best
of our
paper right now
recovery.
in Chicago,
But
did a
there is
fantastic
plenty of data from other
piece
places that are
on
already
the
battling
dramatic Miss Emily
BA2
Landon. I
that
just
show
put the
that even
article in
as
the
it
chat
replaces
if
Omicron, the
anybody
original,
hasn't seen it.
it's unlikely to change the
Sorry that my
original.
stream is.
It's unlikely to change the overall trajectory forward. What did the governor and Dr. Ezike say today? What did the governor and Dr. Ezike say today? I have advised countless people, businesses, organizations, and healthcare facilities about how to address COVID throughout this pandemic. And each one has endeavored to balance protecting health of patrons and employees with their bottom line and their goals. Repealing the mask mandate allows them to choose the mitigation layers that are best for them. And I have no doubt that many of them should and will keep masking rules. This is their prerogative. Including
Is she
COVID risk
saying masks in
assessments
schools can
is
go?
just part of doing business now. Therefore, the mandate ending does not mean that you're entitled to be mask-free everywhere, anytime. If you're leaving isolation early, you have to wear a mask for 6 to 10 days. If you have
Did you
symptoms
say
of
what
COVID,
I'm
you
entitled
need to
to?
wear a
No,
mask.
you're not the boss of my
Having choi-
body. Nope. Nope. Sorry that this stream
Suffice
keeps
it to
going
say,
out.
this isn't an end to the pandemic.
Those are
And it's
bold
not going
statements.
back to normal.
You say you
Although
have to,
I
it
sure
implies
hope it feels
you have
better than the
power
last
over.
couple of months.
Right.
No matter how much we wish for it,
I don't
hope
think she
for
could
it, or
make me do it.
demand it of COVID, this is a virus and it's ruled by biology. It doesn't negotiate with us or care about how we feel about it. We have to adjust to it. And we have to take advantage of the breaks that we get. We're headed into one of those breaks. I know there are some who will see these changes as some sort of confirmation that COVID really isn't that bad. I want to be clear.
Yeah, I agree, Jane. I agree,
If you're
John.
someone who's had the
Pritzker's
luxury
got to
of
know
being
that
able to
Emily
ignore
Landon,
the
I don't even think
profound
plays well
impact
with the
this
panic
disease has
pushers.
had on our country,
So, you know,
our
her being the
communities,
sacrificial
our
lamb, or
families.
right, like
God bless
deflect
you.
our hatred
Please
onto
open your
her,
eyes.
or
Common
our
colds don't
ire. I
kill.
won't say hatred, but you know, ire onto her instead of him. He's despicable. He's despicable. And also, I've long noted. I mean, Pritzker does not surround himself with men. Has anyone ever noticed that? I mean, he's got all these women that are largely younger than he is. I think it's very interesting. Having trouble with the feed right now.
You know, we've talked about this,
440,000
Jessica.
in the
I've
world.
pointed out how he's
And about 5% are
disrespectful to
immunocompromised.
the reporters and the females, and
It
it's
doesn't matter whether people
you know, it's kind
died
of a bad sign, is what it is.
Mhm.
or of COVID.
I don't know
Yeah,
if you want.
Well, Amy
died
Jacobson
because
is there
of COVID.
today, and we know that she's been derided
There's
multiple
good reason
times
to
by
still
the
want to
governor.
protect yourself and
I get
others from
incensed
COVID.
that the other reporters in the room don't,
Immunocompromised
you know,
people like me will
also
still need
ask
to wear
good
high-quality
questions, or
masks
you know, she's kind of
and take
alone in
extra
there for the
precautions.
most
We're
part. Sometimes Marianne
safer if we
Ahern
keep our
will
distance from
ask a pressing
unmasked
question.
people
Let's see what
and
happens
limit our
today,
social
though.
circles to vaccinated friends
Reporters
and
see what's going on in the
family.
schools, right?
But it's the reality.
And
With new
they like
medications
covering that
becoming more
too, right? That
available,
makes for
and we
great
have
TV.
options
Kids
for patients
marching
becoming
out of
more
school,
available,
kids
and we have options for
rebelling,
treatment that
right?
could help make
So
up for some of the
they
protection
do.
that we lose from the mask
They
mandate.
have these competing narratives that are kind of hard to
Many
ignore
people
now.
are
So
going
maybe
to
we'll
feel
see a
more
shift from the
vulnerable
media.
without the mask mandate in place. Families with kids too young to be vaccinated. Even healthy people who live with or have close contact with people who are higher risk. Elderly people. Maybe all of us at one time or another. Please.
This is like
Be
story time with
understanding
Emily
and
Landon. This is
respectful
like watching
when
Reading
someone's wearing a
Rainbow,
mask
except
or asks for a
LeVar
little
Burton was a
space.
lot better.
Doesn't
Seriously,
want to
cut
admit
her
that
mic.
vulnerable people are congregating, like healthcare sick or vulnerable people are congregating, like healthcare facilities will need to keep masking. Crowded and closed spaces with poor ventilation, like public transport, are going to need to set a higher bar for removing the masking rules because the risk
Blah
bears
blah
high.
blah
And
blah blah.
congregate settings where individuals can't really adequately advocate for themselves, like schools, are in this category too. I know everyone wants to see kids unmasked. I do too. But masks have made life livable for all of us.
Nope, they've made,
kept us out
that's a
of
lie.
lockdown.
They've made life
Keeping our
horrible.
kids in
It's a
school right
constant
now.
reminder of
Masks in
fear.
schools
They have
become
divided
so
people.
political that it's hard to imagine anyone thinking clearly
They have
about them,
damaged
but the
kids'
data
development
is
relationally,
unmasked
in
classrooms
terms of
and towns
communication
without
and
school mask
speech.
mandates
We have kids
are
who are
more likely to go
terrified to
home
take their
or
masks
suspend
off, even at
classes when they
home.
wear masks.
Teen girls, moms
They have
tell me
higher
that
rates of
don't want
infection
to
in kids
go out into
and in the
public
community.
without their masks.
While kids have low rates of
These
risk
are
on
lies that
average,
she's
they live
telling.
in social bubbles that include their parents and loved ones and their teachers, who may not be as low risk as the kids. And vaccination in children aged 5 to 11, while better here than in a lot of places, is still under 40%. And those under age 5 aren't protected at all. Like
It's
in
way under
healthcare,
40%,
we
in
need to have
fact,
a higher
which is
bar
good.
for safety in schools.
One dose,
We need to keep them safe.
29.64%
As
statewide
the
for
situation
5 to
improves, we're
11.
going to meet that higher bar. It's not going to take very long.
People who wanted to
And
get their
until
kids
then,
vaccinated
parents
have
and
done
guardians,
so.
This is your chance to get children who are eligible vaccinated. It will reduce their risk of getting COVID. It will also reduce their risk of severe illness or disability from COVID, and reduce the risk to your family and your loved ones. We have
Sorry that my feed is. My
your
internet
family and
is.
your loved ones. We have to take advantage of this well-deserved and needed break from COVID surge life. But the next variant will come, and we'll need a new custom mix of mitigations to address it. But we can't be so sick and tired of COVID that we think the comfort and denialism of not wearing a mask is more important than the life of someone's grandmother. I hope we can use this restorative phase for some real reflection.
Ben Bradley always goes after
about
me
how
on
to
Twitter
make
for
peace
saying stuff like this, but somebody else's grandma's
all
life
use a little
has never
distance
been
from the
my
surge in cases, the bad
responsibility
news, the disappointment, and the missed
or
opportunities.
problem any more than the grandma's,
Hopefully,
you know,
this time will
responsible
allow
for
us
me.
to
I
see
don't
COVID a
understand
little
where
more
this came
clearly
from.
in the context of our future, because that will make the next wave easier on all of us. Thanks, everyone, and I'm going to turn it back to the governor.
Thank God.
You appreciate. Get the mask on. Get two of them.
Okay, here we go.
Oh, my.
Questions. Question time.
Despite all that's been said just now, and I'm not going to surprise you, there are people who are still questioning this decision and say, is it really about the science or is it about your real?
I can't hear
Is
the
it soft
question.
for you guys? I can't hear the questions.
Yes.
Well, when you put the mask mandate in place, hospitalizations were 1,700, not at 1,700.
No, we're not.
So why pick February 20th?
Because we're seeing a trajectory of those hospitalizations. We've come from 7,300, more than that, down to under 2,500 just in the last 4 weeks. And over the next couple of weeks, before we get to February 28th, I think we all expect to see a continuation of that trend.
Would you talk about those, the naysayers, or just your critics who believe this is more about a political campaign than about the science?
These are the same people that wanted us to take masks off or to encourage people not to get vaccinated back when we had rising infections and rising hospitalizations. So it's hard to take them seriously at this point.
I've never encouraged people to not get vaccinated. I don't care if people do or not. Do what you want to do, people. Just for the record. Same with masks. Do what you want to do.
Have 500,000 students right now who are in mask optional schools. Would you consider dropping the appeal and giving the power back to school districts? Are you surprised by so many parents
We already have it.
who are fighting back, who are stuck in mask?
We already have it.
It was an extremely bad decision by this judge. I mean, it's poorly written, it's poorly decided.
Really?
And so we've got to appeal that decision because it takes away one of the tools that we have going forward. You heard Dr. Landon, Dr. Ezike in the past talk about we may see surges in the future. We want to be able to keep everybody safe in the future.
Bingo.
And that case decided in one circuit court downstate in Sangamon County by one judge shouldn't keep us from trying to keep the entire state safe.
But are you going to put the back in two? These kids are.
Yep.
Spoke to a teacher in District 2. My third grade kids are so happy and they're for the first time, in 3 years. So how you're going to take that away from them?
No, look, listen, I'm happy. Listen, I'm happy that kids would like to see this mask mandate go away.
It did go away.
And I would like very much for it to be removed as soon as humanly possible. And I've told you that.
The judge removed it.
Making progress in that direction. But the truth is that we need to follow the advice of doctors, epidemiologists who understand this well. And nobody has wanted to wear masks all the way along. Perhaps you least of all. You've certainly made that clear.
Oh my word. Are you kidding me? Did he just do that?
The scientists about, and again, this is about community health.
Unfreaking believable. He
And
just went
that's
after
why
Amy
we've made the
Jacobson
decisions that we've
again.
made all the way along this
Again.
process. It's about keeping communities and the entire state safe. And by the way, the metrics show that we have. Sorry, I couldn't tell who was asking the question. Just the mask. Yeah, thank you.
Because I couldn't tell who was asking the question because the mask was on.
Look, we're just, being realistic about this. I think you saw that Delta
Staying strong.
reached a peak back last fall, and it started to come down. And we all were very hopeful. And then you saw Omicron hit, and what was a declining number of hospitalizations all of a sudden turned around and turned into a much bigger surge than anybody expected. So we're just taking into account that we don't know if there's another variant out there. You heard about a subvariant that's out there. Again, I think doctors have taken that one into account. But again, the virus all along has been, mysterious in the direction that it's come.
No, it's actually been pretty predictable. It rises and falls as seasonal respiratory viruses do.
Always.
I'm very optimistic, but I've been optimistic.
About what? I'm optimistic about the SmackDown that's coming.
I'm optimistic about a new election.
Yep.
That's what I'm optimistic about. Having a lead.
That's just the law. I mean, the law is that private businesses have always had the ability to put mask requirements in, to have different requirements, mitigations that they may choose. Same thing with organizations, same thing with cities.
So they can choose to put them in, but they can't choose to take them away?
More stringent.
I don't get it. And what about private schools?
Can I just take a question over here? Sorry, I just saw everybody.
Sorry, I see a reporter I like.
Yeah, sure.
Oh, the doctor.
For the pandemic, was said that seem to be a bit in conflict. Can you talk about these two?
Sure. So in 2019, before we knew who COVID was, we weren't wearing masks.
Ooh, I love how they're
So
personifying
February
it.
28th, if things continue in the direction that they have, we will go back to these public indoor spaces where there won't be a mask. So that looks like 2019. But does that mean that COVID is gone? No. So that there's a BC
It will never
before
be
COVID
gone.
and after
It will
COVID.
never
And
be
so
gone.
we are going to be in a point where we might have some people who are not wearing their masks, but that does not mean that COVID is not there. So there's definitely those two things happening at the same time.
Did you hear what she just said? If you see someone with a
But that does
mask,
not mean that
it
COVID
means
is
that
not
it
there.
doesn't
So
mean that
there's
COVID's not
definitely those
there.
two things
That's
happening at
all
the
the
same
mask
time.
was.
That's what right. That's exactly right.
The mask was to tell everyone that there's
That there's danger.
viruses floating
That's
around.
exactly right.
That is true. Yes.
Okay, so Chicago, for instance,
They would, again, anything more stringent than what the state has laid out is possible for any municipality, including the city of Chicago.
Yeah, but still illegal. Still not necessarily legal. Doesn't matter if it's possible.
A school, a municipality, anybody cannot set something that is above the law. That's what the judge just showed us. They cannot do it.
If you don't mind, I'm going to ask Dr. Landa to come up, but I'll just say,
Oh, here we
really
go.
mean weeks. That's our belief at the moment. And again, it's, as somebody pointed out, it's with the hope that we don't see any reversal or a new variant. But it is our intention and our hope that
We're gonna see a new variant.
Yeah, it doesn't matter. Josh, at this point, I mean, like we say down here, the cattle are out of the gate. You're not going to get them back in very easily.
Our
He knows.
theory here is
He knows.
that because of the unusual environment schools are.
No,
present,
they're not
that
unusual.
it would be
They're not.
longer
How
than
many
February
schools has he
28th,
ever
but
been in?
still
How many
within
classrooms has this
you
guy
and
been
my
in ever? He doesn't know
I'll
what a
just say
school
that
is.
Metrics
or
are
looks
really
like.
tough for COVID.
No.
And
Jessica,
it's great
will
to
be-
have one simple metric. CDC recommends like a combination metric of sort of the number of cases and then the positivity rate. Now, both of those together are very useful. A lot of places have decided to go with those, but there are some arguments against it. That isn't really necessarily how sick people are, because that doesn't include hospitalizations. And that now that there's a lot of home tests, it may not be a good idea to choose just case rates. That the percent positivity could be influenced by how many people are being tested for asymptomatic for pre-procedure testing. There's a ton of minutia that goes into each of these things. So you have to kind of look at
And you don't understand it.
and you have to think about all those metrics together. when it comes to schools, I am not a pediatrician, but I will say that I think that it's probably reasonable. The guidance from the CDC is to really stick to those less than substantial transmission before you consider having anybody be unmasked in schools. I think you can be a little bit aggressive when you're talking about whole statewide mandates because you can be more granular by letting people make their own decisions. But when it comes to schools, that can spill over into communities and it can spill over into elderly people in hospitals pretty quickly. So it's kind of important to be a little bit more
You know
careful.
what?
Plus,
The
kids are
Supreme Court said
vulnerable.
it
We should be a little
well
bit more
in
protective.
January with their ruling. They said COVID is a
It needs to not
universal
really slow
risk.
down the trajectory. We need to know
It's
that
everywhere,
kids are
and
not
there's a
likely to
lot of
spread it in
risks
schools and
everywhere.
make
It's not a
schools
greater
be
risk. Well, they
remote
were
and
talking
make
about in,
schools
you know,
be
in certain
remote. We don't
workplaces,
want
but
kids.
you know,
Nobody wants
maybe
kids
if
to
you're
be back in
working in a
remote.
lab
I
or,
think that's the
you know, maybe there are
main
some
goal
things in a
here. No one's
hospital
been
that you can
hurt.
argue, but
Everyone's gonna look
otherwise,
at metrics that are going to help keep kids
it's
in school.
you can't get away from it.
Yeah, there's a number. Yeah. No, that's a state. There's some state data out of Minnesota. There's also there's a whole page on the CDC's website about masking in schools and why it's important. And it shows that in communities where there are not mask mandates, that there's more cases in kids, more cases in the community, and schools are more likely to end up going remote or having to be hybrid or doing these.
Nope.
And so it's important to be a little bit more careful, in my opinion, but it's their decision.
Well, it depends on what you're talking about specifically, but I'll just say that for the moment that we want to make sure that we have teachers getting vaccinated and people getting tested.
Right, but your order is unlawful.
More and more testing made it available to schools. We want them to have it available even when the mask mandate comes off, because there will be certainly moments when having testing allows you to a lot more freedom and not to have to go back to masks.
Governor, there are going to be those who do all this and they're going to say, all right, so it's okay for my grandma to go to the casino, for my uncle to go to the bar, for whomever to go to the Bulls game, but my kid can't go to school.
Yeah.
Or the kid
So
can go
remember the
everywhere else
difference
without a
between
mask,
that.
but
We have
not
kids
school.
going to school for 6 to 8 hours,
That's
5 days a week.
So what? So
week
what?
After week after week.
So what?
That's very different than someone going.
Oh my gosh. Sorry about my feed going out. I don't know what the story is.
Single day and every day. And that's very different. And so we're trying to take that into account while also moving toward removing, mask mandate if we can. And I believe we will.
If we can.
If we can, like it's not in his power. Well, it's not. The judge struck it down. That period.
Yeah, we did.
Well, I don't think that you need to.
I'm sorry. I don't know why this keeps doing this. It's probably my internet, most likely.
What direction these things are going. And certainly we're going to be alerting you when we see signs that things are going the wrong direction. I do think that people are going to need to to keep a mask with them, even if they're not.
No,
even if they're not wearing it. Because
it's like he's a mask salesman. It's like he is I mean, I'm speculating here. I'm not saying I have any evidence of this, but he acts like he has like bought shares in multiple mask companies. I don't get it.
When you get on the bus, you're going to need to put on the mask.
He's going to be alone at the top of Mount COVID mask.
It's almost common. You're gonna need to keep a mask on you.
Mask mandate,
because we might text you and let you know that
things get very
it all of a sudden got dangerous.
This before, with
Put it
the
on.
onslaught of Delta and then Omicron. Boy, masks really helped us to keep transmission rates down. So
it's like he's making $1 million every time he says the word mask in a press conference. I'm not kidding.
We announced that on June 11th, I think, that all of us very hopeful that we might be able to never put masks back on, right? But as we saw,
Yep.
things started to rise, and it was good thing.
It's true, Katie. Nobody has said N95, which is interesting. They're not telling people to wear N95s. It's just any mask, right?
Visual compliance.
You know what? I'm not getting the audio for the questions. Are you guys?
So two things, just to remind you that there was I've been in office for 3 years. The CDC was under different management.
I think he's nervous.
Just a year.
I perceive that he's nervous.
So
Maybe I'm
not
wrong.
always. We've had to sometimes fight the CDC. But in this case, we're following the numbers that the CDC is putting out and recognizing that we're not there yet. And that
We're not there yet.
I am sorry for the tech issues. They're probably my fault.
Summer, or at least
somehow.
in May, when
Eric's
we made
usually
the
with
decision
me.
back last May. My expectation is that, we'll continue to watch what the CDC and listen to what the CDC is saying. But we do think, and I think, again, collectively, and I've talked to other epidemiologists not in the room and people who are infection control specialists, people really do feel that the trajectory here is one that we're going to be able to hold on to.
Governor Pritzker, are you doing this on the Biden is going to following day
Well, I talk to governors all the time about this, and I haven't talked to a specific governor in one of the states that announced it this week, anytime in the last week or so. But we, look, all of us are challenged in our state, slightly different circumstances in each state. I think you saw, I think the Northeast got hit with Omicron before we did. And then it seems like almost like a cloud moving, what east to west. It seemed like it, came to the Midwest and it alleviated in the East before it alleviated in the Midwest. So, it's hard to say that, talking to one or another governor is going to tell you a timing question. It's more, the advice that we seek from one another, governors, is how did you handle this type of circumstance when it came up? I remember, for example, that I called the governor of New York a couple of months ago. This is the current governor of New York, when she put in place a limitation on elective surgeries. You may recall that. And other states were not doing that. And so I was, she announced it. There really wasn't a great explanation in the news. So I called her to say, can you just tell me what's going on in your state? And she gave me some advice about what was happening in her state, not relevant to our state at the time. So not something that we needed to do.
Do one more.
Yes, sir.
What kind of data are we looking for? Kind of mass mandate. As far as what case transmission, etc. What's there to learn scientifically?
I am sorry. I don't know why I'm having trouble with this feed. Maybe Pritzker's people are cutting it off for me. That wouldn't really be surprising.
Results occur, you're not sure which intervention can you attribute it
Here,
to.
try this
Hey
version.
guys, sorry, I
instance,
can't
now
hang on. I
we're
get back.
taking
I gotta
the
get back
big
to my
step,
day job.
hopefully
We'll
on
see you
Thursday,
later.
A little bit.
Okay.
So,
to have
all right, we'll talk to you later.
the
Bye.
indoor
No problem.
mask,
Bye.
mandate for the public spaces suspended. We need some time to make sure that we don't see some kind of unexpected result. So we don't want to take it off in all settings. We can start there and look at it and see what's the result of doing that. And then you can say, okay, we've assessed the result of that intervention. Now we can move to another intervention. Doing two things at once can confound the results and not make it clear which intervention had what result. And so really stepwise moves make sense and allow you to actually evaluate what you've done.
I'm sorry, if I may just add, Doctor, I think, each
Oh,
time that we've had a variant, you're in a new set of, you use the word experiments, but as you know, Omicron was vastly different than Alpha. And so all of a sudden, and you don't know, nobody hands you the playbook on the new variant. You have to watch it. And one of the things that happened with Omicron was, I think we all saw that it hit South Africa, hit Scotland, and UK. And we were able to see when it peaked, it came down at a rapid rate. That was informative, not necessarily what was going to happen in the United States with Omicron, because there's a subvariant. But you're trying to address these things as best you can when they come forward. And again, each one of these is a bit different.
All right. Thanks, everyone.
Up, Jordan decided it's over, so it's over. She's like, he's dying up there. Oh my gosh. All right. Well, that was something else. Let me get back. Let me get out of that. We can chat about this for a minute. Steve, what did you think? What did you think? Were you impressed? Enraged?
It was drivel for so long, right? I mean, it was just 52 minutes of endless, we did everything to save you. And here I am sitting out here that did the exact opposite, and I'm as healthy as I've ever been, knock on wood. I don't get it.
Yeah, I don't get it either. And I don't get what the strategy is. I mean, they're really, every time they do these press conferences and they keep pushing panic, and it's like they want all of these things at once. They want to have their cake and eat it too, right? They want to tell you to keep masking, keep testing, although we didn't hear a lot about testing today, or we didn't hear as big a push, but get vaccinated, variants. It's like a pandemic forever agenda. And I just can't imagine that this plays well with JB Pritzker's base. I mean, even people who are Pritzker allegiant, I mean, really at this point, they think, I mean, it's like Barry Weiss said a couple of weeks ago, right? She's like, hey, like I was sort of all in. I was afraid. I did all the things, all the stuff. I got vaccinated, but like, what the heck? This was supposed to be over. And it just seems like it's never going to end. I don't see how this helps him politically, Steve. Do you?
No,
I know it doesn't play downstate, but.
Well, listen, I mean, if you are watching any of this right now, even up by where you are, look at what the kids are doing. Look at what the kids are doing in the schools. They see this. They've finally seen with their own eyes that all of this, a lot of this was a big lie, what happened to them. They were never in danger of, this virus that God bless them. They were more resistant to that than adults. So they were the least affected by the virus, but the most affected by what government did to them. So they see that. And I tell you what, there's a lot of 18-year-olds in high school that are going to vote.
That's right. Right. I mean, by the time November rolls around, we're gonna have, tens of thousands, if not more, kids who have turned voting age since March 2020, and they're not going to forget who kept them from playing football, who canceled their graduation effectively, who kept wanting to mask them. I mean, they're just not going to forget. And so I think a lot of these kids, and the college students too, are beginning to say, like, hey, like you did this to me, you ruined my life, and like, no, you've got to be out of office. So I hope we have a nice kind of get out the vote. I remember when I was younger, the MTV had that campaign, that Rock the Vote campaign. Right. We need something like that in Illinois this summer, like get out, vote, especially with the young people, because like we're seeing right now, they have such power to turn this thing around, right? Those kids at Naperville Central, the kids at, what are some of the other high school? I've lost track. I've heard about so many things, and I get so many videos at Vernon Hills. I mean, and peaceful, right? Peaceful protests standing up for their rights. But we've got two populations in Illinois. the nursing home residents and the kids that are being forced mass, and they're not being paid to do it, right? 6+ hours a day. Like, hey, doctors, yeah, oh, I'm a doctor, I'm masked too. Yeah, you're making a few $100,000, dude. Or even the person at Target is getting paid to wear a mask, I would say, as part of their uniform. Not that I think that's okay either when it's by force. It's not okay, but there is some agency there that kids don't have. Right. So I don't know how he benefits from this agenda of force masking children. Do you?
I don't see how he can ever benefit from it. And going back to what you said about people being paid versus kids, you have to also remember there are people in those schools that have been, get your mask up, get your mask up, get your mask up. I mean, yes, I understand that workers and different ones have to wear a mask, but they don't have somebody like me climbing their ass every 5 minutes telling them to put that mask up when they pull it down. They sit and talk to their workers or what have you. And that is really the tragedy of all the bullying from adults to children. And I mean, it's all the way up to the governor's mansion. You can see that today, how he has just continued to do this. And I think voters are turned off by that.
Yeah.
It's an absolute great opportunity for, suburban moms. Everybody talks about them, the suburban moms. That's you, Jessica. You're a suburban mom.
That's me.
It's an opportunity for them to sort of stamp out this hatred from kids that they've done in the governor's mansion throughout 2 years. That really is what it is. They've not looked at the mental health of kids. They've not looked at the educational value that has been destroyed from having kids' faces covered. If you try to teach a first grader phonics, you can't. They have to see your mouth move. My wife could do this better than me. She's a reading specialist, but you can't do it. You can't teach the letter sound properly.
Yeah, well, and you know what? This year, I mean, people finally, admitted the obvious truth that, we shouldn't shut down schools. We shouldn't keep schools closed, right? And now, it's kind of like safe to admit that. By this time next year, if not sooner, people will admit that forcing kids to cover their faces really hurt kids in a lot of social, psychological, and developmental ways. So they're not gonna escape the truth coming out. And I don't know how he keeps denying. I kind of wish a reporter would ask him, like, there's thousands of schools across the country and around the world where kids it's mask optional. It's mask optional. Like, how do you continue to justify this? But we're seeing him dig in. I wish he would pull the appeal back. He's not going to, right? But I think somebody said, maybe somebody in the chat knows, but I don't know when this appeal is expected. I mean, I don't know that it's going to come before the end of the week. I don't think it will. So like Amy Jacobson said, I've said it on Twitter too, the toothpaste is going to be really hard to put back into the tube. So he's got a mess on his hand. The Archdiocese of Chicago, even last night at midnight, no less, announced mask optional in Lake County schools that it has authority over. And then much of suburban Cook, not Evanston and Oak Park, which have their own health departments, and then not in Chicago. But please, do we think that the Archdiocese of Chicago is going to keep up the charade until even Friday? I think that the bluff is going to be called on this. What do you think, Steve?
Yes, I absolutely do. And what we've seen around here throughout the last few months, kids start taking masks off in school, and their friends start seeing that, oh my gosh, they're okay.
Right.
And even the parents, and now we have teachers across downstate Illinois all over the place with mask-free faces, and whatever their unions might have told them, they realize, you know what? We're fine. Our kids are fine. Everybody is fine. And every day that goes by, even during this appeal, more kids and more kids and more kids are safely taking their masks off, and they're getting the strength back in their heart that they know they're okay. Right. And that's going to be a huge thing. You're not sticking that back in the toothpaste tube. You're not going to do it.
Right. John Halgren said, it's surprising that they haven't already appealed. They have. There is an appeal. There's a filing. I don't think briefs have been filed. And I know different groups of people have been talking about filing amicus briefs along with that. But I think at the earliest, I think we would be looking at a decision, I would think, is Friday. I mean, again, I don't know all the mechanics of all of this. I can't speak to it. But again, by then, even by Friday, we'll have, a lot of kids in Illinois, at least like 500,000 or so, that have been in mask optional schools all week. So I just don't think it's going to happen. And Steve, I think the message, we'll wrap up here, but I think one message that needs to be sent loud and clear is that the advocacy is for mask choice. And I have told my daughter that. I emphasize that with her all the time. And we've chosen to not wear a mask, in most of our lives everywhere, except maybe boarding an airplane and things like that. And she's been in this, mask force situation in school this year. But this week I've emphasized to her, you can tell other kids that they have a choice. You can evangelize, so to speak, to other kids about that reality at your school now, but like be real sensitive, girl, be real sensitive. If kids are still wearing masks, like, hey, it's Wednesday. I told them this morning, it's Wednesday. The kids know they have a choice. So you can just assume that that's their choice. And so just engage with them, smile with them. Let's not talk. Don't try to talk to them about the mask. And I don't think she will. I don't think she does. But that needs to be the message. And really, we need more parents and kids on board who are choosing masks for themselves, but do believe in choice for everybody, right? Like, I think once we get some of those people on this train, that's it. It's just going to be over. And then, you'll have a minority that still want everybody to be forced masked. But in time, I think with love and support and showing those people grace, like, I think we can get out of this. But we need JB Pritzker out of office as well, right?
Well, so I mentioned this, maybe, I don't remember if it was today or whatever on Twitter, but unity. Right now is a time for calm, peaceful unity.
Sure.
We have some kids in school that maybe have their mask off and other kids that have their mask on. And we don't need either one of those sets of kids nagging the other one. We just need them to go about their lives in peaceful unity and just live that way. And I think that's what will end all. We will have people realize that. I kind of learned a lesson early on when I started advocating to get rid of masks. And I had to check myself, Jessica. I was always saying, we can't have the mask. We can't have the mask. And then I realized, you know what? That's not the right approach, Steve. You want a choice. I wanted to choose whether to have that on or not. And there's times when I might be in a grain bin. I choose to put a mask on for health reasons. And if some people still believe that in their heart, I can't ask what's in their heart. I cannot do that. I cannot tell them to do. So we've always advocated for choice, whether it's the vax, the mask, what have you. We have to be there at this point in time in our history that we have to maintain choice.
Yeah, I think I agree. Choice is the off ramp. Choice is the unifying concept here. And, I don't mask, but if I'm ever in a grain bin, if I'm ever in the grain bin with you, I'm masking, Steve. That's it. I'm masking. So, all right. Well, thank you for joining me today. I know we'll connect on Twitter and through some other stuff. And thanks for everybody who's hung with us for the chat. I hope you have a wonderful day full of all kinds of choices, including about masks. Take care, everybody. Bye-bye.
Thanks.